Hi, my name's Haley Damasio. Starting off with some of my personal interests, that includes going to the ocean, spending time at the beach. I really like going hiking. Just did some hiking at Acadia, headed up to Rangeley to do some hiking in the next couple of days. I really enjoy thrifting. It's something I do to, enjoy some time. I really like cats. I have some pet cats, but I also have fostered lots of cats and kittens. I like turtles. I have a pet turtle. I'll put a picture in my discussion post of him. And I really like photography. I've been doing a lot of macro photography lately. Put some pictures of that too. As far as my employment goes, I work at Central Maine Medical Center. I started there as a CNA in the float pool, and then I transitioned to an RN doing med-surg, and that's still what I do now. But after I got my RN, I went back and got my BSN, and now, I'm doing my master's program. Background, I did start college at USM, but ended up at the Maine College of Health Professions, where, like I said, I got my associate's degree, and then I went to UMFK for my bachelor's degree. And now I'm at Husson. I am in the family nurse practitioner program. I'm hoping to work in women's health. There is a certification that you can get that I'm hoping to go back and continue to do. But I do want to work at like a women's health center, providing women with education and resources, especially now with, everything women are facing being taken away from them. I want to be somebody helping in that situation. Excitement, challenges, or apprehensions beginning this course. When I read that, I was like, okay, so what's the course description? And it says, this course focuses on the role of a leader in complex healthcare organizations. The student examines theories and processes for conflict resolution, negotiation skills, operations management, and strategic planning across the continuum of care in healthcare organizations. And I think nurses are really taking on the leader role more and more from what I'm seeing. And that's really exciting for me, Nurse practitioners are taking on these roles, nurses, and it's exciting to know that soon we'll be the ones taking on these roles. I think nurses make great leaders, and to know that this course is going to help us in complex leadership is great for me. Apprehensions, I think, are the same as anyone else. We're doing this course and other courses, and we're working full-time, school's full-time, and we're trying to balance our lives on top of that. And I think starting an additional course would give anybody apprehension, but, I'm excited to keep going and to do it, so. And then describe how you plan to achieve patient-centered care. And I think a big thing for me is empathy. I think that sometimes it can be lost. We are so used to the same thing. We do this every day, and burnout is real as well. And I think we forget how we would feel if we were the patient, or how we would want ourselves or our family members to be treated if they were the patient in these situations. And I think another thing to consider is when you have a really tough patient, what kind of life must this person have lived to end up how they are? I think it's important to consider that and to be empathetic to, you don't know everything that's going on or why they're acting this way, and I think it's important to be empathetic. Dignity kind of falls hand in hand with that, where, we do this all the time, and something as simple as like closing the curtain or telling your patient what you're doing gives them that little bit of dignity, because even though we're used to it, they're not used to it. So it's really important to give them a level of respect and dignity that you would want for yourself or your family. And then a last thing for patient-centered care for me is personability. You still have to maintain the level of professionalism and a separation between yourself as the provider and your patient. But personability, I find, gets you a long way with a lot of people and can really help patients want to learn, speak up if they're having any questions, and in general, it's just a great aspect to have as a provider. So, looking forward to the course.